Bismillahirrahmanirrahim. Assalamu alaikum. Many times I have been asked what should be the dietary precautions during Eid-Ul-Adha. So today we shall discuss different dietary precautions during Eid-Ul-Adha. These dietary precautions include: number one, make easy swaps to reduce your sugar, salt, and saturated fat intake. I repeat again, make easy swaps to reduce your sugar, salt, and saturated fat intake. Second, be mindful of portion sizes. Be mindful of portion sizes. Third is managing your blood sugar levels. Managing your blood sugar levels. The most important is another precaution: get your fill of fiber. Get your fill of fiber. Consume good amount of fibers. This is very, very important. In Eid-ul-Adha, most of our food portions include meat, protein. This should be avoided. We should have adequate amount of fiber in our food. And another important precaution is remember to get advice from your doctor for any personalized precautions. If you are diabetic, if you are hypertensive, if you have metabolic syndrome, if you have liver diseases like hepatitis, cirrhosis, or if you have gout, high uric acid levels, then this is again important to get advice from your doctor. Your doctor will be giving you a personalized advice. And the most important precaution, rather advice, I must say, is be active. Do physical activity. This is very, very important. Please remember, once again I say, these are general suggestions, and anyone with specific dietary needs should consult a medical professional. Thank you.